All right, now we're going to talk about menopause. So menopause is a point of time where females begin to stop the instances of menstruation, right? So there's a cessation of menstruation, and this is due to either the atrophy of the ovaries, but usually it's due to the decrease in steroid hormones, specifically estrogen, right? And so this is the functional consequences of estrogen and progesterone to being at very, very low levels, right? And so because of this low level, right, remember when we talked about the function of estrogen and progesterone is to create secondary sex characteristics, gamete formation, and hormones relative for pregnancy. Those aren't present anymore, so now these patients that experience menopause, which is almost 1 million a year that are diagnosed with menopause, experience instances of infertility, right? And so when we talk about menopause, the first symptom that is really diagnosed is a phenomenon called hot flashes, right? So hot flashes is an instance where your body, due to the hormonal abnormalities, become excessively hot, so you begin really to sweat. Your metabolic rate increases exponentially, right? And so these patients experience this problem that becomes very, not necessarily damaging, but it becomes very uncomfortable, right? Because your core body temperature has skyrocketed, right? And so this usually is due to the abnormality of the menopause right here, right? And so age of onset is usually relevant. It's very variable too as well. So patients, for example, experience menopause on average around the age of 50, 55, right? When you have the premenopausal symptoms, and then usually it lasts between 3, maybe 5 years. It can even be sooner, it can be later. It all depends on the person. The age of onset can also be affected as well. So for example, people that are smokers, they have a higher tendency of a sooner menopausal presence, right? So whenever menopause they're diagnosed with, it can happen earlier, right? And so this, again, has to do with different kinds of tendencies of messing with the abnormalities. So certain patients that experience birth control or certain congenital defect can also have early instances of menopause for the actual patient, right? And so when we look at more symptoms, right, besides the hot flashes and increased core temperature, we have to look at every single body part right now, right? So when we look at specifically here for the female, we're looking at the vagina. The vagina begins to dry, right? So they have the dry tendency because of the glands, the exocrine glands that are secreting all the fluids become, obsolete. They now become functional. There's a decreased vascularity, decreased secretions. What else is there? And because of this phenomenon here right now, you have this lack of membrane that originally was purposed for protection against this open system. Now these patients experience high instances of infection, right? So people that experience menopause, right? So again, it has to do with the decrease in estrogen/progesterone levels, right? And this eventually leads to instances of decreased fertility, right? But remember, these hormones can be replaced, right? So these patients, whenever they go through instances of menopause, they have to get treatment, and the treatments that they usually experience is called HRT, and HRT stands for hormone replacement therapy. HRT. Right, and so hormone replacement therapy is basically giving the patient certain doses of estrogen, right, to begin to revitalize everything. So these patients don't become fertile, right? So they don't begin their cycles all over again, right? Because the ovaries themselves become fibrotic, the uterus atrophies, right? So there's no actual place to generate ovaries, generate eggs, fertilize them, and actually implant into a certain location, right? And so this becomes a problem. But whenever you have these treatment, this is just to treat the actual symptoms taking place of the other body systems, right? For example, cardiovascular problems can arise because of this, right? People with certain skin conditions can have, let's see, what else? Certain kinds of skeletal abnormalities. So a lot of these patients with menopause experience a phenomenon called osteoporosis. So osteoporosis, as it states, is when the bone, osteoporosis, when the bone becomes highly porous, right? So this porousness makes them susceptible to fractures, right? So this treatment is to prevent any kind of osteoporosis. Women, in terms of their nervous system, in terms of their behavior, they experience instances of anxiety and depression. They have changes in certain kinds of cognition and memory, right? And so these abnormalities are usually treated with HRT, hormone replacement therapy, right? But again, a problem with HRT is because it is a steroid, and the steroids are usually are more potent. They're all natural steroids. This can lead to a lot of other problems too. Certain cancers like breast cancer, prostate cancers, for example, for males, the ovarian cancers as well. And so this is the general understanding of what menopause is and how a lot of these treatments are given for the patients in order to maintain a normal lifestyle, a more comfortable lifestyle, if you would.